Welcome to the Sunday Times, the weekly public affairs show of 96.5 Jack FM that keeps you connected to the issues and resources in your community. With your host, Lee Callahan.
Good morning, everyone. Welcome back to the Public Affairs Show of your favorite iHeart radio station. I'm Lee Callahan. The perfect storm has happened. Our local blood supply is in dire straits. On the phone with me from Bloodworks Northwest, I've got Executive Vice President, Blood Services, Vicki Finson. Good morning, Vicki. It's great to have you back on the show.
Good morning, Lee. Thank you for spending some time with me today. I appreciate it.
Our blood supply is very low. We're using it up as fast as we're getting it, right?
We are using it almost faster than we're getting it.
Yeah.
We're a little nervous. We've been nervous for a few months. We are literally down to a one-day supply most days. So it is going out as fast as it's coming in.
So tell me about this perfect storm of bad stuff that's happening to keep us so low on blood.
Yes, it's another storm.
Yeah,
I think we've got a lot going on here for everyone in many ways, in many industries. Of course, healthcare has been significantly disrupted during the pandemic. And what we've seen since spring is really a very prolonged challenge with the nation's blood supply and the local blood supply, as we've seen a decrease in the number of people donating blood and an increase in people, not showing up for their appointments or canceling their appointments at the last minute, which then it makes it really hard for someone else to take that spot.
What do you think, Vicki, is causing these last-minute cancellations? Is this always happened, or is this a new thing?
Well, it seems to be new. We thought during the summer it was a lot of folks back out doing summer activities, nice weather, et cetera. But it has continued into this fall, and my gosh, it is fall already. Mm-hmm. I personally think it's just a bit of pandemic fatigue continuing on.
Yep.
So if that is the reason, and there's a lot of noise out there, right? So I think it's harder and harder for our message to reach people about the fact that we transfuse blood 365 days of the year, and we need blood every single day. So if your listeners are listening, I would say to you, if you're looking for something joyous to do, something that will make you feel great to know that you're really helping someone, and we will take great care of you and we will keep you safe, then please go to bloodworksnw.org, Google us, and please make an appointment because we are appointment only.
Yeah. Vicki Finson, Bloodworks Northwest, is on the phone with me, and you've got a shortage of staffers like phlebotomists. You need them. Tell us about having a career as a phlebotomist.
Yes, well, being a phlebotomist at a blood center is very, very, very different than being a phlebotomist at a hospital. And I am in no way saying that phlebotomists who work at labs and hospitals aren't also important healthcare givers. They are. Mm-hmm. But we call our phlebotomists blood collection specialists because the phlebotomy part is a very small part of what they do. They spend time interacting with our wonderful donors. They do the health history, the entire screening process, and then they do the collection part. So the actual phlebotomy part, which to someone who maybe doesn't know what that word is, it's sticking a needle in someone's arm, right, to get blood out, is a really small part. They learn all the different technologies that we have to collect platelets and other things. So it's a great profession. We have career advancement within our blood collection specialists. So they start as associates and they can become fours. And many of our supervisory and management team staff all started as blood collection specialists as they began their career. What I've found, Lee, I've been in blood banking for a long time, and many people stay in it for a long time, like I have, because it's a very rewarding career.
Yeah.
We're part of healthcare. We're saving lives, but quite frankly, we don't deal with sick people. So many
quite the contrary.
Correct. We're dealing with well, healthy, happy people who are there because they want to be there. Mm-hmm. They've chosen to be there. So it's a very joyous event, and the environment when people are donating blood at our centers or our pop-ups is happy. It's about life and it's healthy. So I've known many people who've started at the blood bank thinking they were going to go on to other healthcare careers, but then they realized, wow, this is great. It's healthcare. And I'm dealing with well and happy, healthy people every day.
Absolutely.
It is it's a tough labor market right now. And we had, some resignations over the summer, and we're having a really hard time filling them because there's just a lack of labor. And I know everyone I talk to in every industry is experiencing the same thing. We have just adjusted our starting wages, trying to attract more people as well.
Yeah.
We're working on lots of great things to improve the workplace experience for our staff. So if you're listening and you're interested in starting a new career, we do all the training ourselves. We would welcome. Go to our website and you will see that we have positions open as blood collection specialists throughout our entire geography.
Great. There's another incentive. If you give blood between now and the end of the month, you will be entered to win a flyaway trip to either LA or Nashville or New York or somewhere else. I mean, these are big flyaway gifts. You will be entered to go to a music festival or a concert in one of these places. So you just go to bloodworksnw.org/music.
We're trying to just have fun, and we're calling it Music's in Our Blood.
That's right.
Music connects us all, and so we think that it's fun. We have the whole campaign lasts through the end of the year, so there's different things, October, November, December. So if you are a music fan, which I hope you are, this is a really great way to save a life and have some fun with some music as well.
Yeah, no kidding. Hey, good work on that one. Next, there's been some fears people have if they've just had the vaccine, they feel like they have to wait or something to donate blood. That is not true, correct?
That is not true, Lee. You're right. Correct. There's no waiting period. You could actually donate blood the same day you get your vaccine. I would encourage you to wait a day and make sure you're feeling well and healthy. I would also, as a scientist, encourage you, if you have not been vaccinated, to really get vaccinated. It is something that will protect your health, but also protect the health of the community.
Yeah, and I'm assuming that every phlebotomist in there is vaccinated.
Bloodworks has chosen to also require vaccination of our staff, similar to what Washington and Oregon are doing, but it is our own policy. And so, yes, and our dates do coincide with the two states. So we are in the process of working that all out, and we'll be in compliance by October 18th.
Wonderful. And tell me about how spectacularly clean and sanitized your centers and your pop-up blood drives are, because I've been, and I love giving blood. I feel so good. People are so happy to see me, and then the cookies, and it's just a great experience. You leave feeling really good about yourself because you have helped save a life. Tell me about the precautions that are in place. Yeah, you read my mind, Lee. I was just going to mention about safety precautions. So Bloodworks was very much in the forefront partly because we were here at the epicenter of the pandemic in the United States. In March of 2020, we put a lot of measures in place to protect people's safety. We've added to those measures as we've all learned more about COVID, and we've not removed any of them. Right. We believe that that is the right thing to do. So we are still social distanced at 6 feet. We are still masked, our donors and our staff wear medical grade, procedural grade masks as well for their protection as well as the donor's protection. We are appointment only, as I mentioned before, and that ensures that people aren't waiting. There aren't too many people in the space. We have all of our facilities set up so that social distancing and there's no crowding. We also sanitize and clean things even more than we ever did. Of course, blood centers are always very, very, very cleanly because of what we're doing. And we've kept everyone safe during this pandemic, and I'm proud to say that, and I'm proud of our staff for how seriously they've taken their own safety, but the safety of the donors
and ultimately the safety of the entire community.
Right on. And before we go, Karen Finson, Executive Vice President, Blood Services, back to saving lives. Tell us, where does our blood go?
Oh my gosh, blood is used so many ways. You know, a lot of people think about some big event happens and then they want to go donate blood. So the first thing to remember is the blood has to already be there. So it's going to take 1 to 2 days at least after you donate blood for that blood to actually, probably 2 to 3 days, for that blood to be all tested and prepared and labeled and then sent out to the hospitals. So it has to be there beforehand.
Yep.
So trauma, of course, all kinds of trauma from car accidents to anything else, and someone working at a construction site and getting hurt. I mean, we read those things in the news, and many of those people use blood. Highly commonly transfused are folks undergoing treatment for cancer and leukemia, because chemotherapy wipes out your own ability to produce blood cells. People undergoing transplants of organs or bone marrow transplantation following chemotherapy. Mothers giving birth and their newborn babies, especially if they're in an intensive care ICU, a neonatal intensive care unit. People undergoing
babies need blood transfusions. Babies,
absolutely. Babies need blood transfusions often. So most premature babies who are in a NICU, a neonatal intensive care unit, get transfusions. They get transfusions because they're not quite ready to be born, right? But they also get transfusions because they often undergo surgery, and they also get transfusions because they get so much blood testing done to monitor them that they need blood back. Because when you think about a baby, there's not a lot of blood in a premature baby. So then surgery patients, of course, all kinds of surgery, open heart surgery, certain other kinds of vascular surgeries certainly would use blood. So that's just to name a few. And then there's the people who just have bleeding disorders. They get blood transfusions. Our sickle cell patients get transfused all the time. So it's complicated, and we have to keep that blood and all the different blood types and all the different blood components at all of our hospitals so that it's ready when that patient needs it. It needs to be there on site for them.
Pop-up blood drives, where can people find one in their neighborhood? I mean, you can come to a donation center. You've got tons of those, but talk about the pop-up blood drives. Yeah,
so we have the 12 donation centers, and we have pop-ups all the time. They change. They're in different geographies. And so going to the bloodworksnw.org or just Google Bloodworks, it'll take you easily to Donate Now, and you can find a location and a day and a time that works for you. Lee, I want to say one thing. Sometimes people get a little frustrated. They'll go in and they'll go, okay, I'm going to donate this afternoon. Well, guess what? Those appointments are full. So then what I hear people say is, you must not really need me. No, we need you. We need you. We draw blood 364 days of the year, and blood is needed every single day. So I think sometimes it could be a convenient excuse of, I can't get in right away. Well, come in November then. We will need you then too. So make it so it works for you, and remember that you can donate every 56 days. So we would encourage people to donate 3 to 5 times a year.
Great. Yeah, you're using this blood up as fast as you're getting it, right?
We are using it almost faster than we're getting it. Yeah. We're a little nervous. We've been nervous for a few months. We are literally down to a 1-day supply most days. So it is going out as fast as it's coming in. So thank you, Lee, for helping us get the word out, and thank you for your continued donations. And also thank you for mentioning those cookies, because that is a nice little treat you get at the end.
Yeah, everybody go to bloodworksnw.org. Vicki Finson, I'll talk to you again.
Yes, thank you, Lee, so much.
You're welcome.
Stay safe.
You too. Bye-bye now.
Bye.